Unraveling the Link: Maternal Eating Disorders and Children's Respiratory Health. In a groundbreaking study published in Thorax, researchers have uncovered a startling connection between eating disorders in expectant mothers and an increased risk of asthma and wheezing in their children. This revelation challenges our understanding of the impact of maternal mental health on offspring and prompts a call for action in healthcare. The missing piece in maternal mental health research. While previous research has predominantly focused on the effects of depression, anxiety, and stress during pregnancy, this study sheds light on the often overlooked impact of eating disorders. The researchers emphasize the limited evidence surrounding these less common conditions and their potential consequences for children's physical health. Unveiling the data: a comprehensive analysis. To strengthen the evidence base, the researchers analyzed an extensive dataset from 131,495 mother-child pairs across 7 European birth cohorts. They examined the associations between maternal eating disorders before pregnancy and the respiratory health of their children, specifically preschool wheezing and school-age asthma. The prevalence of maternal eating disorders varied significantly across the cohorts, ranging from nearly 1% to a concerning 17%. Coexisting depression and anxiety were also prevalent, with rates varying from 11% to a high of 75% among women with eating disorders. The impact on children's respiratory health. The findings revealed a 25% heightened risk of preschool wheezing and a 26% increased risk of school-age asthma for children born to mothers with eating disorders. These risks remained relatively consistent across the cohorts, despite some variation. Exploring the associations: anorexia, bulimia, and timing. Interestingly, the study found similar associations between childhood asthma and both anorexia and bulimia. Preschool wheezing, however, was only associated with bulimia. The observed associations varied slightly depending on the timing of exposure, before, during, or after pregnancy, but no clear window of susceptibility emerged. Unanswered questions and potential mechanisms. While this observational study provides valuable insights, it cannot establish a definitive cause-and-effect relationship. The researchers acknowledge the wide variation in the prevalence of eating and respiratory disorders across the cohorts, which may impact the comparability of findings. However, they emphasize the stability of the associations across all analyses. The underlying mechanisms linking maternal mental health and childhood respiratory outcomes remain unclear. The researchers propose that mental ill health and associated stress may disrupt the baby's lung development and immune system maturation during pregnancy, increasing susceptibility to immune-mediated conditions like asthma. Additionally, they highlight the potential role of genetic factors, as both mental health disorders and asthma involve dysregulation in immune response and inflammatory pathways. A call to action: integrating support for better outcomes. The study's authors emphasize the need to include maternal eating disorders in research on early life respiratory risk factors. They advocate for the integration of eating disorder screening and support into maternal healthcare to improve respiratory outcomes in offspring. By addressing these disorders early on, healthcare professionals can potentially mitigate the risks and improve the long-term health of both mothers and their children. Final thoughts and a call for discussion. This study opens up a crucial conversation about the impact of maternal mental health on children's physical well-being. While the findings are intriguing, they also raise many questions. What are your thoughts on the potential mechanisms underlying these associations? Do you believe that integrating eating disorder support into maternal healthcare is a feasible and effective solution? We invite you to share your insights and engage in a thoughtful discussion in the comments below.